Back pain and what it has to do with the pelvis. A schematic approach to treating lower back pain amongst other common symptoms of pain. Hi, I'm Anna Hayes and I'd like to share with you in this presentation why all the different connections that we have in our body are really important to be aware of when we are treating our clients, whether they be people or horses. Specifically, I'll describe the incredible importance of pelvic alignment in lower back pain, as well as often being the source of many other pains in the body. And I'll give you a clear schematic approach to treating lower back pain that I've been using very successfully for more than 10 years now. We'll be looking at the various connections that we have in the body and the importance of these when we are treating common symptoms of pain. This will be followed by looking at some specific examples for neck, shoulder, lower back, jaw and foot pain. What else should we be thinking about when a client presents us with their symptoms of pain? This is important whether you work with people or horses. We'll then look in detail at a schematic approach to treating lower back pain that I've been using now for over 10 years. And in treating hundreds of people, I've only ever had 3 which did not immediately respond, and 2 of these because there was a benign tumour in the spine. Connectivity. So what connections do exist within our bodies? What else could we be looking at when somebody presents us with just a painful joint? We are all, of course, aware of the musculoskeletal system, the bones, the skeleton and the muscles connecting them. As the old song, "Dem Bones" goes, the leg bone's connected to the knee bone, I can't sing, the knee bone's connected to the thigh bone's connected to the hip bone, now shake them skeleton bones. The bones are connected one to the other. So when somebody comes in with knee pain, we should also be looking at the hip joint, the ankle joint and the foot. With neck pain, we should be looking at the shoulders, the top of the rib cage and the cranium. With lower back pain, we should also be looking at the pelvis and the hip joints. I was lucky enough to study a little under Terry Lee, and I will always remember her deep American voice in my head. Think of the bones. The muscles are attached to the bones, so if we first think of the bones when we are treating, and those bones shift and realign, the attached muscles will also realign, all of them, all in one go. We usually don't need to stop and think about treating individual muscles like a physio possibly would. Think of the bones, and muscular tension will often dissolve too. Tom Myers has made us aware of the myofascial anatomy trains, the muscular fascial connections that run from top to bottom of the body. These are incredibly important connections that can explain why, for example, neck pain can be associated with a torsion of the body and pain in the lateral side of the knee. A dysfunction in the fascial system, like adhesions or stiffness, can lead to diffuse radiating pain that is much harder to localise than muscle pain. And the trick here is finding out what the chicken is and what the egg is. What is the original cause of the pain, and where does this lie? A knowledge of the anatomy trains can be extremely useful in analysing this. In the Ortho-Bionomy training, we learn about the fascial diaphragms within the pelvis, the respiratory diaphragm, the thoracocervical transition and the tentorium cerebellum. These transverse fascial diaphragms hold much more than just physical tension within the body, being strongly associated with emotional and mental tensions as well. They are vital to treat if any trauma is involved. And then we should also consider the general fascial network, the fact that everything is connected to everything else via the fascia. Biotensegrity is the biomechanical model applied to this phenomena. Now let's just stop and consider this. Everything is connected to everything else. pain in one area of the body can cause effects throughout the rest of the body. We are connected. Research has recently shown that the meridians, known from traditional Chinese medicine and acupuncture, may run within the fascial network. So releasing tension in the fascia is likely to have beneficial effects on the meridians and thus on the energy flow within the body. It's important that we also consider releasing any fascial tension around the area of treatment to improve the long-term outcome. Fascia has up to 6 to 10 times more nerve endings than muscle. It's now considered to be the largest sensory organ in the body, packed with mechanoreceptors detecting pressure, stretch and movement, nociceptors, the pain receptors, and plays a major role in proprioception, the body's sense of position and movement. If we release tension in the fascia, we will necessarily be releasing tension within the whole of the nervous system, helping to bring the body into the parasympathetic state. Now, most horses love to be stroked, and I start a treatment by stroking them gently, yet very consciously, from head to hoof. In this way, I'm making contact with their fascial system, with their largest sensory organ, already beginning to release tensions and encouraging them into the parasympathetic nervous system. I can then continue with the treatment, able to now safely touch places where they may have a lot of pain and gently treat them with Ortho-Bionomy. Many people don't like to be touched, let alone stroked, which is a great shame. And this brings us to the vagus nerve. The vagus nerve is the main highway of the parasympathetic nervous system and governs our rest and digest state. 80 to 90% of its fibres are sensory, meaning that it's constantly reporting back to our brain about the state of our inner organs. It's involved in the gut-brain axis and influences emotions depending on the state of the gut. We have the possibility of treating the vagus nerve directly. I place my fingers on either side of the neck, just behind the sternocleidomastoid muscle where the vagus nerve runs, make contact with the nerve and ask for a phase 5 balance, a technique I learnt with Terry Lee. Or we can treat it indirectly by treating the organs of the digestive system. The nerval connections to the inner organs play an important role too in our analysis of where the original cause of the pain may be. One good example of this is the liver. Pain in the right shoulder can have its origins in a dysfunction of the liver or the diaphragm and have nothing to do with the musculoskeletal system at all. The phrenic nerve, which supplies the diaphragm mainly but also supplies the outer covering of the liver, shares spinal roots with the shoulder. Liver inflammation, gallbladder issues or diaphragmatic tensions from emotional stress cause signals to be sent to the brain, which the brain then interprets as shoulder discomfort. So, if you've been treating shoulder pain that just won't seem to shift, consider looking at the inner organs of the digestive system. And then we have the cranial sacral system, which also helps to control the autonomic nervous system. So the rest digest, the parasympathetic nervous system versus the fight, flight or the sympathetic nervous system. When the cranial sacral system is disrupted by trauma, stress or tension, it can affect everything from mood and sleep to digestion and pain perception. And of course, in Ortho-Bionomy, we have wonderful methods and techniques to treat the cranial sacral system. In terms of connectivity, it's worth noting here that the sacrum is connected to the cranium. If there's tension in the sacrum, in the pelvic ring, there will be tension in the cranium, often associated with tension at the base of the skull. Now, I found this particularly evident with horses. Tension in the sacrum, meaning restrictions in the hind end movement, will be causing tensions in the poll at the top of the neck and vice versa. We've just looked at all the physical stuff, but what about the psyche, the emotions, and the mental state of the person or horse that we're treating? Well, we've just heard that the cranial-sacral system can be disrupted by trauma, stress, or tension. And this can then affect everything from mood and sleep to digestion and pain perception. However, the mind-body connection is a two-way street, where of course our mental and emotional state also affects our physical bodies. Chronic stress will activate the sympathetic nervous system, our fight-flight mode, and leads to increased heart rate, increased blood pressure, a suppressed digestion system, as well as a suppressed immune system, elevated cortisol and adrenaline levels. Emotions like fear, anger or grief trigger hormonal cascades that then can affect pain perception and immunity. Alternatively, positive emotions can promote healing and reduce inflammation. Many health issues are not just in your head, they are embodied experiences. For example, depression and anxiety often manifest physically in fatigue, muscle tension, headaches, digestive issues, chronic pain, and sleep disturbances. Psychosomatic responses occur when the mind speaks through the body, when real physical symptoms have an emotional or psychological root. Psychosomatic symptoms are not imaginary, they are very real. For example, anxiety can manifest physically as chest tightness, nausea or dizziness. Grief can be associated with fatigue and immune suppression. Anger with tension headaches and high blood pressure. Shame with digestive upsets and muscle contraction. Unprocessed trauma can become stuck in the body, especially in the fascia and the nervous system. This can lead to chronic pain syndromes such as fibromyalgia, postural imbalances, and emotional flashbacks triggered by physical sensations. And as physical therapists, we need to be aware of this. Just by touching a traumatized body, there is always the potential for an emotional flashback. For example, if an elderly woman presents chronic knee pain to me, and we treat her knee, or I treat her knee, I may inadvertently trigger an emotional response because when she was 4 years old, her beloved big brother pushed her down some steps, hurting her knee, and she never did understand why he did that. In a safe therapeutic environment, the woman and her body are able to understand the connection, and the traumatic experience can be released. Let go. Now this is a relatively benign example, but an important one to keep in mind when touching someone. I was once treating a colleague's foot on a training course with Terry Lee, and after I'd finished the treatment, my colleague still seemed somehow stuck. I was confused and called Terry over. She immediately said, "Ground yourself, Anna." And then there was a pause, and then, "No, more." And at that moment, my colleague let go and was able to tell us about the massive trauma that had been associated with that foot for many years. Since then, when treating, I imagine that I'm a massive rock on the bank of the river of emotions that the other person is feeling. I can have empathy, but not sympathy with that person, for then I too would get swirled away in that river of emotions. I need to stay solid as a therapist, on the bank, with my feet well and truly grounded, for that person to hang on to, and hopefully be able to scramble out of their river of emotions and let go of all those emotions. There are various systems that utilise the connectivity of the body that we can use as therapists, either as diagnostic tools or as therapeutic tools, or both. We learn in our Ortho-Bionomy training about the Chapman points and how we can use these as a therapeutic tool to treat dysfunction in the inner organs. They're thought to represent viscerosomatic reflexes, where any dysfunction in the organs is reflected in changes in the fascia and the lymphatic tissue near the skin surface. They offer a bridge between internal organ health and surface level bodywork, and so allow us to treat the inner organs by treating a specific area of the skin. Chapman points are not the same as acupuncture points, but they may overlap in location. I've used my knowledge of acupuncture points to work with them energetically by resting my finger on the surface of the skin as the needle, and this is quite different to acupressure. Here again, using a technique such as this, you've got access to a completely different system of treatment, stimulating energy flow through key meridians. Now, the acupuncture points, stomach 36, spleen 6 and liver 3, for example, are extremely useful to aid and boost overall digestion. I also learned that one should be very careful of needling kidney 1 on the sole of the foot. But working energetically, as just described, it acts as a powerful yet gentle calming of the nervous system, grounding the person's energy. I've also found that knowledge of the dermatomes has proved invaluable to me over the years. Each dermatome is a strip of skin which is supplied by a single spinal nerve root. They form then a segmental pattern across the body, horizontal bands on the torso and spirals down the legs and arms. They're extremely useful in diagnosing possible nerve root compressions, so which vertebra may be the cause of sciatic pain down the leg or nerval pain down the arm. Knowledge of the dermatomes, together with knowledge of the nerval connections to the inner organs, can also be useful in understanding referred pain, for example, the liver causing right shoulder pain. The meridians are like invisible energy highways in the body, connecting organs, tissues and systems. Blockages or imbalances of the meridians can lead to physical symptoms, emotional distress or illness, and stimulating specific acupuncture points can help to restore the energy flow, relieving pain, improving digestion, calming the nervous system and supporting emotional release. The chakras, now they're like the energy hubs for our body and also influence our physical, emotional and spiritual well-being. When balanced, energy will flow freely between them. But when blocked or overactive, we may experience physical symptoms, emotional imbalances or spiritual disconnection. In Ortho-Bionomy, we're able to feel and, if necessary, help to rebalance the energy of the chakras. Now, each chakra is associated with core themes, and again this knowledge can help us to understand the whole of the issue that a client may bring to us. And of course our bodies are connected throughout our physical, mental and spiritual levels energetically, phase 6 as we know it, as well as interconnected with everybody and everything else, phase 7 and above. The all-seeing, all-being level of internal knowledge. Here, the internal healing process, innate to us all, is activated. A level where we don't need to consciously think of all the possible connections anymore. A level where in the safe space that we hold, the all-knowing healing process can take place. Having now delved quite deeply into the real importance of connectivity when we're treating, and having discussed all the relevant systems that at least I could think of, you may be relieved to hear that I'm now going to simplify things somewhat. In the next few slides, we'll be looking further at some of the common symptoms of pain that we're presented with in the practice, and delve a little deeper to see what other connections we maybe should be looking at too. Now let's look at knee pain. If someone presents me with pain in their knee, what else would I be looking at? I always start with the bones, after Terry's advice. Obviously, we'll be looking at the knee joint itself, the connections between the femur and the tibia, as well as the alignment of the patella. To which joints do these bones lead on either side of the knee? And as we can see clearly in this diagram, looking up the body, we should also be considering the hip joint and of course the alignment of the pelvis. And then looking down the body, we should be looking at the ankle and the foot. I usually use what Terry called phase 4.5 to treat the knee joint itself. Focusing first on the connection between the femur and the tibia, I will test in all 3 directions and use a standard phase 4 compression in the free direction for each direction tested. Similarly with the patella, I will test in the 3 directions and initiate a phase 4 compression downwards towards the knee joint in the free direction for each direction tested. After a direct treatment of the knee, whether that be using phase 4, 4.5, 5 or 6, I then like to settle the system by completing a sandwich technique in phase 5 with one hand under the knee joint and one hand above, with my awareness on the fascia around the knee joint, and this often seems to ease any residual tensions. Same principle can be used when treating the leg joints of horses. It's also worth bearing in mind at this point that any tension in the tensor fasciae latae down the outside of the thigh, running between the hip joint and the knee joint, can cause significant discomfort and misalignment of the knee joint. There's also a fascial link between the SI joint and the knee via an anatomy train. This is particularly important to be aware of if you're treating horses, as a blocked SI joint will often be linked to stifle issues. What's the psychosomatic relevance of the knee joint, and how might this affect the treatment? Our knees are used for bending. If they are too stiff or too flexible, this may give us a hint about how the person reacts and thinks. There are also several Chapman points associated with the knee. Posteriorly, points for the sciatic nerve, and anteriorly, points for the female genitals and for the lymph nodes in the groin. Stomach 36 is a key acupuncture point along the stomach meridian and is known for its wide range of benefits, including boosting immunity, improving digestion, reducing fatigue, and alleviating pain. And this point can be found 4 finger widths below the kneecap and 1 finger width towards the outside of the shin bone, and can be activated by taking up a deep contact with a finger on the point, as I described earlier. Pain in the knee may well be associated with lower back pain, as the dermatome for L4 runs over the knee joint, and of course both knee joints also have their own chakras. As you can see, knee pain may not just be knee pain. If you treat it as such and only treat the knee joint, more than likely the client will either not return because you haven't sorted the cause of the pain, or will continue to return because you haven't sorted the cause of the pain. As therapists, we need to consider the connections. We need to be looking at the person as a whole and not just zooming into the specific area of pain. So let's look at the bony connections associated with lower back pain. A pelvic misalignment is the critical factor here. If the pelvis is twisted or tilted in any way, it will take the lower vertebra sitting on top of the sacrum with it, and they will be twisted or tilted too, causing muscular pain or worse, nerval compressions. It's imperative to treat the whole of the pelvic ring, the ilium, the ischium, the sacrum, the SI joints, the lumbosacral joint, and only then to treat the lower vertebra if you want long-term success in treating back pain. And yes, if this doesn't completely do the trick, which it often does, you'll need to look at the other connections, the hip joint and the knee, as well as the alignment of the feet. The deep, strong ligaments and fascia of the SI joints can hold an immense amount of tension. We have wonderful techniques to release this. With horses, I found it extremely beneficial after treating the SI joint directly by bringing a compression into the joint via the iliac crest, to place my fingers along the SI joint and with phase 5 to think deep, deep into those ligaments on either side of the sacrum, feeling them then slowly release like butter underneath my fingertips. The longitudinal fascia along the spine will often benefit from a gentle ortho-bionomy treatment. Fascia contain many more nerve endings and muscles, and sometimes significant back pain, particularly of an emotional nature, can be caused by these fascia tensing up along the spine. And we've got so many techniques to help relieve this tension. Always with back pain, it's worth considering the emotional or physical load. Are they carrying too much? Are they doing too much? Being aware of these issues as a therapist will help the person to be aware themselves, and if necessary, we can then point them in the direction of a counsellor. There are several Chapman points around the pelvic ring, anteriorly and posteriorly, for the male and female sexual organs, and it's worth considering here, what's the chicken and what's the egg? Are dysfunctions in these organs causing the lower back pain, or is the misalignment of the pelvis and the subsequent back pain causing a dysfunction of these organs? There's a triangular area between the lumbar vertebra and the posterior iliac crest for the colon. Interesting, this. In my experience, lower back pain is often associated with digestion issues, and vice versa. Digestion issues can be associated with lower back pain. So it's definitely worth asking if your client suffers from digestion issues, and then testing, and if necessary, treating these points as part of a lower back pain treatment. The bladder meridian runs either side of the spine, so paravertebral. It's used in TCM, traditional Chinese medicine, for diagnosis purposes, each point on every vertebra being related to an organ or body part, many being similar to, but not exactly the same as, our Chapman points. With knowledge of the bladder meridian, we too can use this as a diagnostic tool. And with our connectivity hats on, we also must realise that any dysfunction of the spine will affect one or more of these points, and so potentially cause a dysfunction of the associated organ or body part. Now, the dermatones are an essential diagnostic tool when presented with somebody who has sciatica and lower back pain. We can use the dermatones to get an idea of which vertebra may be causing the sciatic pain in the legs, depending on where that pain runs. For example, if the person has pain in their foot, we know that L5, S1 or S2 may be involved, depending on where exactly that pain runs. Sciatic pain going down the outside of the leg to the foot will inevitably be associated with a misalignment of L5 or S1, whereas pain which crosses the front of the knee will be associated with a dysfunction of L4. The sacral nerves, if trapped, tend to cause issues around the buttocks and possibly down the back of the leg to the heel if S2 is involved. Almost inevitably, the sacral chakra and or the root chakra can be an important part in lower back pain, often linked with psychosomatic issues. It's worth looking at the deeper meanings of these chakras if lower back pain is resistant to a phase 4 treatment. Treatment of the sacrum can often lead to a simultaneous treatment of the sacral chakra. If somebody presents themselves to us with neck pain, we can see here, as illustrated in this diagram, that yet again a misaligned pelvic ring could be the cause of the neck pain. This is one reason why I almost always start any treatment by checking the alignment of the pelvis. A misaligned pelvis will cause a misalignment in the shoulder girdle, possibly also involving the first rib, and the neck and upper thorax vertebra will become twisted or misaligned as well, just like the lumbar vertebra with lower back pain. This can then cause tensions or nerval compressions in the neck, which can then involve the atlanto-occipital joint higher up or even into the head. If there's tension in the atlanto-occipital joint, there will be tension in the sacral area. Anybody working with horses will know this. If the horse won't let you work at the head, you work at with the sacrum, and much of the tension in the pole will also be released, and vice versa. If the horse threatens you when you're working at the hind end, you can often begin working with the pole, the atlanto-occipital joint, so also releasing tension in the sacrum. And so we come full circle back to the importance of pelvic alignment for neck pain and stiffness. Once the bones of the pelvic ring, the shoulder girdle and the neck vertebra have been treated, the fascia of the neck will definitely benefit from being looked at, but also the two fascial diaphragms, the cervical thoracic transition and the C0-C1 fascial diaphragm. These are vital to treat, along with the other fascial diaphragms mentioned previously, if any trauma is involved. In psychosomatic terms, the neck represents flexibility, movement, and alignment. Neck pain and stiffness is often then associated with uncertainty, fear, or anxiety, where each individual vertebra mirrors different aspects of the psyche. C1 is connected with the brain and the nervous system, C2 with the sensory organs, the eyes, nose, ears, and mouth, and dysfunction here can be related to repressed emotions. C3 is associated with fear and the inability to communicate. C4, 5 and 6 have a strong connection with the thyroid and the ability to verbally communicate, while C7 is influenced strongly by the sense of morality and spirituality of the person. There are many, many Chapman points along the neck, for the neck itself, and also for the brain, and for the sensory organs, the eyes, nose, ears, tonsils, tongue, sinuses, and one for the ileocecal valve between transverse processes of C2 and C3 on the right side. So we have a connection from the neck to the digestive system, and of course a connection from the digestive system back up to the neck. Who ever thinks to ask about the person's digestive system when they come in to have their neck treated? Though, if we also have a little knowledge about TCM, traditional Chinese medicine, we will know that the digestive organs are related to various sensory organs. For example, the liver is related to the eyes, the kidneys with the ears. And the point gallbladder 20, which is commonly used in acupuncture to treat headaches and neck pain, is located at the base of the skull, in the hollows between the neck muscles on either side of the spine, more or less situated where the Chapman point for the eye is located. And just building a nest and treating this point can significantly help to release tension in the neck. This can be given as part of a self-care routine for people with recurring neck pain. Similar to sciatica, pain in the arms can often be tracked back to a nerval compression in the neck, and here again the dermatomes are really useful as a diagnostic tool. For example, pain in the fingers can be traced back to either C5, C6, C7 or T1, depending on which finger is involved. When treating the neck, though, don't forget the influence that the thoracic vertebra can have. Pain in the armpit can often be tracked to misalignments of T1. Pain in the skin of the head can relate to misalignments of the upper vertebra C2 to C4. And interestingly, I've often treated carpal tunnel syndrome successfully just by treating the neck. The throat chakra is located at the base of the neck, which is the energy centre for communication. An open and balanced throat chakra is associated with clear, confident communication, while a blocked chakra can lead to difficulties in expressing oneself, feeling unheard, or even being overly talkative. Any neck stiffness will be causing an energy congestion in the throat chakra. I hope you're getting the idea now that it's always important to look further than the pain itself, to look at all the possible connections in order to try to discover the true cause of the pain. Only this way will we be able to help clients, be they people or horses, in the long term. Just treating local symptoms will not bring long-term satisfaction. Let's quickly look at a few more examples, but we'll focus now on just the physical aspects of a treatment. If somebody comes to you with foot pain, would you think to treat their thorax? Well, if they have pain underneath their foot in the plantar fascia, you maybe should. The plantar fascia is connected to the Achilles tendon, which is connected to the calf muscles, for which there is a neurolymphatic point after good heart between T11 and T12. Very often the reflex point that we have for T12 on top of the iliac crest is sensitive, so I start the treatment with a pelvic alignment, including a treatment of the T12 point, whether that be with phase 4 or 5, and the pain underneath the foot will most often already be relieved. I usually follow this up then by testing the alignment of T11, T12 and L1 and further if necessary. One session, and this usually does the trick to relieve the pain underneath the foot, and I haven't even treated the foot at this stage. Pain in the foot itself or on top of the foot will require a treatment of the foot itself, thinking of the bones and making sure that each is in alignment with the other. Do this thoroughly, and again within 1 to 3 sessions, most foot pain can be relieved long term. I had a client who came to me after having had excruciating pain for over 2 years. The doctor had said she'd needed to wait for the bones to fuse. Well, they hadn't. After 3 sessions, realigning her pelvis and all the bones in her feet, she was back walking in the mountains. The jaw and the pelvis are connected through various interconnected systems in the body, including fascial networks, neurological pathways, and embryological development, leading to a surprising link between jaw tension and pelvic floor dysfunction. Stress and habitual holding patterns can cause tension in the jaw, which then transmit through the body, potentially affecting the pelvic floor and contributing to issues like pelvic pain. And vice versa, a misaligned pelvis can cause tensions in the jaw. The hyoid bone underneath the tongue can be massively affected by these tensions, as it has no bony connections, only muscular. I see this particularly in the horse, where the hyoid bone is just massive, and if misaligned can cause all sorts of problems in the jaw. Again though, I always start with an alignment of the pelvis. If this massive connected structure is not aligned, I've got no hope in realigning a twisted hyoid or jaw. It's always a game of which is the chicken and which is the egg, and it makes sense to me to start with the most massive structure, knowing and believing in the power of Ortho-Bionomy to be able to rebalance where it's needed. The interconnectivity between the thorax and the pelvis via the respiratory diaphragm is particularly important in the horse, but also in the human. As with neck pain, there's little point in treating the shoulders if the pelvis is misaligned. A misaligned pelvis means a twisting of the spine and possible pain, tension in the respiratory diaphragm and other visceral organs, potentially a rotated thorax to compensate the misalignment of the pelvis, which can then cause upper thorax or shoulder pain. And it's not uncommon that after a pelvic realignment, the shoulder pain or the upper back pain will either get significantly better or disappear altogether. A knowledge of all of these connections is vital for the long-term success of treating the symptoms that the client brings to us. But there seems to be a common factor that keeps on popping up here, and that's the pelvic alignment. Lower back pain is probably the most commonly occurring problem that many of us see in our practices. The temptation here is to directly treat the spine as we've learnt in our training, to test for the painful points and to then treat them accordingly with whatever technique or phase we feel is appropriate for us and for the client. However, I soon discovered that this often meant that the client would return with recurring pain. I have a PhD in biomechanics, and after some research it made sense to me that a misaligned pelvis was possibly the initial cause of lower back pain. In essence, it's a mechanical problem. Think of the bones, the skeleton. When the pelvis is misaligned, the vertebra of the spine sitting on top of the sacrum will be taken with that twist and won't then be stacked in a straight line, but will be twisted, causing pain. And as we've seen earlier on, this also means that the shoulders will be misaligned, which means that the neck vertebra will not be in a straight line either, as they will try to reorganise themselves to keep the eyes horizontal. Neck, shoulder and back pain can be the result. Looking down the body from the pelvis, if the pelvis is misaligned, is higher on one side than the other, then one leg will be longer than the other, creating unnatural loading of the hip, knee, ankle and foot joints, and possible pain in these joints too. And this is the reason why I almost always start a session by treating the pelvis, the whole pelvic ring, the ilium, the sacrum and the pubic bones. When the pelvic ring is stable, the rest of the body has a chance to realign itself, and if not, then we can help by looking at the shoulders, the jaw, the back and neck vertebrae, the hip, the knee, the foot alignment. The pelvis also holds and protects our central energy source, and that means that when the pelvic region is under tension, our energy can't flow freely. And people often report after or during the treatment of the pelvis that something flows in one leg or the other, or spookily both. And this is often accompanied by a feeling of relaxation within the whole body. So, how should we go about a pelvic realignment? It is imperative to test and, if necessary, treat the whole of the pelvic ring. The two hip bones, the ilium, the symphysis, the pubic bones, the sacrum, the SI joints as well as their ligaments, the lumbosacral joint and the lower lumbar vertebrae. And I work in this order. We all know the techniques for treating these individual structures, so I won't be detailing them here. With the hip bones, I tend to work with phase 4, testing for a rotation and then following with phase 5 if required. Usually there'll be a rotation either anteriorly or posteriorly of one or both of the hip bones, and sometimes an inwards or outwards tilt as well. The symphysis is a sensitive area to work with for both men and women, but it's really necessary to ensure the alignment of the pubic bones. If left, this alone can contribute significantly to the continuation of lower back pain. With women, I work directly, testing in the craniosacral direction as well as the ventral dorsal direction with phase 4, and then following with phase 5. Sometimes phase 6 becomes involved if there are emotional or historical issues. And with men, I usually use the more indirect isometric technique. The sacrum should be tested in all its 3 directions of movement: left, right, up, down, a roundabout twist, and also across the 2 diagonals, so there's 5 directions. Again, I test clearly and then treat with phase 4 following into phase 5 in each direction before moving on to the next direction. Next come the SI joints, where I use a phase 4 compression into the point of pain on either side, followed by a phase 5 the deep ligaments holding this joint, where I place my fingertips along the joint and allow my focus to sink into those ligaments. The lumbosacral joint, if painful, I also treat with a simple phase 4 compression into the joint, And then I work with the lumbar vertebra from L5 upwards, usually with a follow-on reflex, but again, simple phase 4 techniques will also work wonders. From experience, I found that 1, 2, 3 sessions are usually required to stabilise the pelvis if lower back pain is the issue. And then I either never see people again, or they return every 6 to 8 weeks just to keep it that way. If there's connected pain at a location away from the pelvis, for example in the knee or the shoulder, then you'll have to decide which is the chicken and which the egg, possibly working on both locations in the same follow-up session to try to avoid a seesaw effect. But I almost always start any treatment with a pelvic alignment. After 13 years of practice, I've had an amazing success rate using pelvic realignment to treat lower back pain, often after only a 1-hour treatment with a second hour booked just as a follow-up. And usually I don't see these clients again, as it is a long-term solution. I've had several clients come from our local orthopaedic hospital still bent over and crippled with lower back pain and taking the strongest painkillers. After only 2 to 3 sessions, their pain has been significantly reduced or released completely, and they've then only occasionally required painkillers to continue to work doing their manual job. These people usually come back every 6 weeks or so as a preventative measure in order to keep their pelvis aligned and free. We can conclude, I think, that pelvic alignment is important for almost every case of pain that we see, be that lower back pain, hip, knee or foot pain, neck, shoulder or pain in the arm, craniosacral issues, or even pain caused by psychosomatic issues. In the Ortho-Bionomy training, we learn phase 4 techniques to treat various joints within the body before further developing these skills with phase 5 and phase 6 techniques. When I started in practice though, I had little idea about how to comprehensively treat the symptoms that people were bringing to me, be that lower back pain, neck pain, shoulder pain, stress and anxiety, or even trauma. And over time, it became increasingly apparent to me that many of the joints that we had learnt to treat as an individual item were connected, as were the physical and emotional aspects of these symptom-related issues. And I hope that I've shown here that a knowledge of these connections is vital for the long-term success of treating the symptoms that a client brings to us. I strongly believe that this more holistic approach to treating symptoms of pain and dis-ease could and should be more reflected in the Ortho-Bionomy practitioner training program. This would benefit us as practitioners and also our patients alike. So, have fun playing, discovering all those connections, and thank you for listening.